Mental health is an issue that affects many St. Lucians, yet it frequently goes unspoken. Conditions such as anxiety, depression, burnout, and stress are increasingly surfacing in our neighborhoods, at work, and within our households. However, recognizing the problem is just the beginning. The latest episode of TV30 focused on the value of mental health and featured guest Patrick Ferron, a clinical mental health counselor with the Employee Assistance Program, who explored the concept of mental well-being.
We're really talking about our emotional well-being, our psychological well-being, our social well-being. For example, you think about persons dealing with the aspects of emotions, the feelings. How do you deal with these feelings that we have, whether it's anger, whether it's sadness, grief? And you think about the concept of your psychological well-being. How do we think? How do we reason? How do we strategize? And you think about our abilities to be functional in our workplace, in our local domestic environment, in the broader society. It's all about functionality, emotionally, psychologically, and socially.
This year, the observance is centered around the theme Turning Awareness into Action. Sasha Jean-Pierre James, manager of the Employee Assistance Program at the Department of the Public Service, spoke about key indicators that may suggest someone is struggling with mental health challenges.
Sometimes you may interact with an individual and you realize that the individual has started to withdraw from others. There's isolation. Sometimes this individual would lose interest in just daily activities, things that a person would generally love before, and all of a sudden you realize that this person no longer is interested in these activities. These are some of the examples that, or signs rather, that an individual may be experiencing poor mental health. You may find difficulty sleeping, difficulty concentrating.
Physical symptoms can sometimes be misinterpreted as signs of a medical condition. Jean-Pierre James further explained this occurrence, known as psychosomatics.
An individual may go to the doctor thinking and feeling that they have some medical issue, and it's really high stress levels, tension, headaches, and so many other symptoms that an individual may experience to give you an indication that this person is experiencing poor mental health.
Jean-Pierre James emphasized the importance of involving children in the mental health conversation, noting that they are often overlooked in this area.
Many times you would hear individuals say to a child, why is it that you're stressed? What are you talking about that you're stressed? But when we look at mental health, as Mr. Ferron would have highlighted, we're looking at the emotional, the psychological, even your physical health would impact your mental health. So children need to be made aware of what mental health is so that they can then be able to deal with their own mental health challenges. When they go to school, they face various problems like bullying, and these issues can impact a child's mental health.
For Choice News Now, I am Darrell Lionel.